All right, listen up. Today's mission is for all you medical pros gearing up for your boards. We're not just here to memorize a bunch of random facts about the thyroid. We are going to master the logic of the body's metabolic thermostat. Okay, let's get into it.
So let's get one thing straight, right from our guy, Dr. Collins. Medicine is not a memory contest. It's about understanding the system. Because when you're under the gun in an exam, rote memorization is going to fail you. A deep, logical understanding, that's what gets you the win. And that's our entire focus today. To get things rolling, we're doing a high-speed strategic briefing coming straight from Dr. Collins. Get ready for this. It's the entire logic of the thyroid in under 30 seconds. Pay attention. First up, the absolute basics. Just think of the thyroid gland as the body's metabolic thermostat. Simple, right? It's controlled by a command chain you've probably heard of, the hypothalamic pituitary thyroid axis, or HPT axis. This is the master control system. And the fuel for this whole thermostat setup? It's iodine. The entire process, and I mean everything, hinges on getting iodine into the thyroid cells. And that job is handled by a special pump called the sodium iodide symporter. So once that iodine is inside, the real star of the show takes over, an enzyme called thyroid peroxidase, or TPO. You can think of it like a master factory worker. It does three critical things: oxidation, organification, and coupling. Bam, bam, bam. That's how you build the final thyroid hormones. You know, the system is so smart, it even has a built-in emergency brake. The Wolff-Chaikoff effect. If you get a huge flood of iodine, the gland literally just shuts down production for a little while. It's this crucial self-regulation thing that prevents you from getting poisoned by your own hormones. Now this is the critical challenge. When your TSH is low and your T4 is high, you've got two main suspects: Graves' disease and thyroiditis. Graves is a factory in total overdrive, sucking up iodine like crazy. Thyroiditis? That's a damaged gland just leaking out old hormone with pretty much zero uptake. You absolutely have to master this distinction. Let's go. Excellent. Now, before we dive into the simulation, Dr. Collins has a mandatory safety protocol. This content is purely for educational purposes, designed for international boards. It is not medical advice. Always, always consult official guidelines and a specialist for any clinical decisions. Got it? Good. Okay, with that understood, let's step into the clinical arena. We are going inside the iodine factory with a case simulation. For this part, I'll be voicing both our mentor, Dr. Collins, and his very sharp colleague, Sarah. Sarah, you're with me? Exam room 1. We have a 30-year-old female. She's got a racing heart, moist skin, and she's been losing weight. Now the labs, TSH is basically 0, 0.01, and her free T4 is through the roof. But here's the kicker. Her radioactive iodine uptake scan shows a diffuse 80% uptake. The whole gland is lit up. So, tell me, what's the mechanism behind this hungry gland? And here's Sarah's analysis, right on it. Sir, that's classic Graves' disease. What we're seeing are thyroid-stimulating immunoglobulins hijacking the TSH receptors, basically flooring the accelerator. The factory is in hyperdrive, cranking out massive amounts of new hormone. That's why it's soaking up all that iodine. So, to really get what's going wrong in Graves', let's just quickly review the normal production line. It's a 4-step process. Step 1, iodine gets in. Then steps 2, 3, and 4 are all handled by that TPO enzyme we talked about: oxidation, organification, and finally, coupling, to create T3 and T4 hormones. That's the normal process that Graves' disease has totally hijacked. And now, we've arrived at the very core of today's mission. This right here is the single biggest trap you will see on thyroid questions for the boards. This is the difference between passing and failing, and, in the real world, between correct treatment and, frankly, clinical malpractice. Dr. Collins now poses the one question that springs the trap.
Exactly. It's a synthesis factory. But what if she had the exact same symptoms, but her uptake scan came back near 0? Does that mean she's not thyrotoxic?
And this is where Sarah drops the bombshell. Sir, that's the synthesis versus leak trap. With 0 uptake, the gland isn't overproducing, it's leaking. This is subacute thyroiditis, probably from a recent virus. The follicles are damaged and they're just dumping stored hormone. Giving a synthesis blocker like methimazole here is malpractice. The factory is already offline, there's no synthesis to block. The correct treatment is supportive care with beta blockers and NSAIDs. It's a common mistake, but you can't fall for it. This is your key to avoiding the trap. On the left, you've got Graves' disease, the running factory. It's actively making way too much hormone, so the uptake is high. You treat it by blocking the factory with methimazole. On the right, you have thyroiditis, the cracked pipe. The factory is offline. It's just leaking stored hormone. Uptake is zero. You treat the inflammation. Same symptoms, totally different problems and treatments. All right, we've exposed the trap. Now it's time to lock this logic in for good. We're going to run a rapid-fire drill with Dr. Collins and Sarah to solidify these key distinctions in your brain. Okay, Dr. Collins starts the drill. Final contrasts. Ready, Sarah? Ready. Graves, RAIU, high and diffuse. Toxic goiter, RAIU, focal hotspots. Subacute thyroiditis, mechanism, inflammatory leak. Factitious, thyroglobulin, low. Wolff-Chaikoff, trigger, excess iodine.
Logic sealed. There you have it. The logic of the hyperthyroid state, locked and sealed.
And a final command from Dr. Collins to end today's mission. You've mastered the furnace when it's running too hot, but the war isn't over. Your next objective is to understand what happens when the thermostat fails completely. Your next mission, E2.2, hypothyroidism. Move out. Your objective is clear. We'll see you for the next explainer.